Good morning, Peak on Ice Daily Show. How are you? Happy Clinical Tuesday. Welcome to the PT on Ice podcast brought to you by Clinical Excellence. I'm Dr. Lindsay Huey, one of our lead faculty for extremity management, along with Dr. Mark Gallant. Pumped to be with you all today. Today, we are going to chat about the top 10 things I want you to know about myofascial decompression. This is a tool we like to use in managing our extremities well and pain modulation. So I want to dive into those top 10 things to know. But before I do, I'd love to tell you about some courses that Marky and I have coming up. We are stacked in the new year. So, Mark and I just kicked off our first course, both of us this past weekend. And then, pretty much every weekend for the next couple months, there's an opportunity near you. So, this weekend, Cody and I will be in Ohio. So, if you want to come join us in Marysville, we will be there this weekend. And then, January 28th, 29th, I'll be in St. Augustine, Florida, with Dr. Eric Chaconis, our original extremity faculty. So he'll be working with me. That should be a blast and lots of sunshine. So if you want to get away from the cold, come join us. And then February 4th, I'll be in Fenton, Michigan. With the Health HQ folks. Definitely join us if you can. And we're definitely wadding on Friday at 12. Would love to see you. There's lots of room there. Megan Daly and I will be there. And then February 18th, Mark will be in Onward Bellington, 18th and 19th in February. If you need some oysters or excuse to get to Washington, go at it. I could just keep going and I won't. So join us at ptonice.com to figure out a weekend that matches up with your schedule. We would just love to see you and have a blast with you. All right, so let's chat about myofascial decompression. So I want to cover just a quick and dirty list for you, because like I said, we use this in a ton of our extremity management, both in the upper and lower quarter. And to learn what that is, please come to our course. But down to business, who is the leader in this space? Well, it's Chris DiPrato and his team. He's known as Cup Therapy on social media. If you're not following him or Facebook, I highly recommend you do so, as he is a leader in this space, really debunking myths associated with myofascial decompression. So he's a must follow. And one of the reasons I say they're a leader in this space is because Chris and his team, they combine evidence, clinical expertise, and then patient values and experience, and they've really developed an inclusive and eclectic approach for reasoning, which I really appreciate. I took both level 1 and level 2, and I'm one of their providers. So that's number one. Who's the leader in this space? I'd highly recommend Chris and his team from myofascial decompression cup therapy. Number two, cupping. This term you hear thrown around by healthcare practitioners, patients. You see it in the Olympics, right? I think Michael Phelps was like the first one to really bring some fame to this practice, but this really is an ancient practice. And so we want to be really intentional of understanding cupping. That term generally we'll say is described or is referred to a technique that uses cups placed over the skin that creates a negative pressure through suction. And it has been used in different cultures since BC times. So we find evidence of it in Romans, Greeks, Chinese, in the Egyptian literature, Mexican American healers, and then Native and South American. So it really is entrenched in history and used really differently. There's wet and dry cupping. Wet cupping draws blood intentionally. The thought is they're bringing toxins to the surface and getting rid of them in the body. Dry does not. It just uses negative pressure. But we're not. We are going to think about dry cupping in what we're using in myofascial decompression. But I want to tell you some things that it's not, right? So if you Google it, cupping therapy, Google says this: cupping therapy is an ancient form of alternative medicine in which a therapist puts special cups on your skin for a few minutes to create suction. People get it for many purposes, including to help with pain, inflammation, blood flow, relaxation, and well-being, and as a type of deep tissue massage. That is not exactly what we're doing, but there's the basic definition. One other definition you'll see in Wikipedia. We have to know this, team, because our patients are going to Google this. Wikipedia says cupping has been characterized as a pseudoscience and its practice as quackery. So I wouldn't be jumping on here on the PT on Ice to tell you to be doing quackery with your patients. To be clear, we are not necessarily trying to relax our patients. We are not doing a pseudoscience. We are not claiming to affect organ systems. Here is what we are doing. We are doing what is called myofascial decompression. We are creating negative pressure which bring changes to the skin and underlying surfaces. And then we're getting our patients to actually move after that. We're creating an opportunity for movement, decreasing pain to allow more freedom of movement. I want to read you what myofascial decompression, so Chris DiPrato and team's definition, because I think it encompasses um, very well what we're claiming to do when we use this in our management of humans. So the kind of what is the definition and the rationale behind it is number 3 that I want you to know. So myofascial decompression is a novel approach to manual therapy and exercise that combines negative pressure technology with evidence-based movement science principles in orthopedics and sports medicine. We focus on incorporating cupping therapy to achieve efficiency of motion with fascial mobility and neuromuscular re-education, literally taken straight from myofascial decompression's website. This is a definition I'm comfortable with, and this is the intent in which I am thinking about when I'm treating my patients using curved cups. Just so you know, that myofascial decompression was a coined term originally coming out of the University of California, Berkeley in 2008. So it is relatively a new term. And it was really born from seeing people with orthopedic injuries that weren't responding to our traditional joint mobs, our joint manipulation, those high velocity, low amplitude thrust, and then just soft tissue techniques weren't cutting it, and exercise wasn't cutting it. And so this was trialed and saw really good effects. So, some underlying rationale. So, this other part of number 3 that I want you to know about is not only that definition about myofascial decompression, but really straight from Chris himself, because I messaged him and I said, what do you want people to know about myofascial decompression in regards to a rationale? And this is from him. So, the theory, the rationale behind it is we're improving space and gliding surfaces of skin and muscle tissue. We're creating an opportunity for lubrication with hyaluronic acid, and then that helps improve distance in the fascial structures and helps with fluid exchange and mobility. Number 2, neuromodulatory effects, right? There's this bigger window of opportunity to get exercise in or to load in that would otherwise be painful. And if you've been to extremity management, you always hear me say, what we do is we create modulating windows of opportunity to load and get that patient tissues more resilient, their mindset more healthy and resilient. So know that that neuromodulatory effect of myofascial decompression is really what we're going after and what we go after when we exercise, when we educate, right? They're far reaching effects. Lastly, the underlying, like kind of top third rationale behind myofascial decompression would be blood flow. It creates metabolic efficiency via circulation excitation. If you take the course from Chris, they go into a lot more depth here, but those would be those main ones to know. So, of our top 10 things I want you to know, we're at number 3. We're moving on to number 4. Myofascial decompression is quick and efficient. The actual treatment time should only be 3 to 5 minutes. So if you have ever experienced myofascial decompression yourself or have done it to others, the actual treatment shouldn't be longer than 3 to 5 minutes. And that should involve not just laying the cups on and letting them sit, but a mix of some type of active and passive range of motion or gliding those cups along the surface. Maybe total length of time of application. That 3 to 5 minutes I just referenced, and then taking the cups off, that might be 8 to 10 minutes. So you get a lot of bang for your buck and quick changes. Number 5, I want to review just some application basics. When you apply cups, I prefer the curved cups that Chris's team sells, but use whatever cups You often use a lubricant. Any lotion's fair game. Creams like Free Up or Biotone, oils, and even analgesics like a Biofreeze, right, or a CBD oil you can use to maximize application efficiency and just comfort for the patient, because that's what actually helps those cups glide a little bit as you incorporate active movement into their system, or you glide the cups themselves. It's not required, but it makes it more comfortable. Initially, you're using a pump and applicator to create that negative pressure. 2 to 3 pumps initially to just assess patient tolerance is great. Don't go right at it really intensely. And what I mean by that is like 8 to 10 pumps. That's usually for a larger cup and or someone that is a little bit more experienced in using cup therapy. You always, only always want to respect tissue pressure gradients for specific tissue. If you're trying to go after lymphatics versus getting down to muscular tissue, and Chris's the course myofascial decompression, they literally go over the MHGs, right? They go over the amount of pressure that's required in each region. So take the course to know that. But it is a science in that they've found now through literature specifically what kind of pressure is appropriate for different body regions. So you'll always respect that. And then when you're placing the cups, you're usually putting it like mid-range tension for the tissue that you're targeting. And then you will use, as mentioned already, a mix of passive or active approaches after you've placed the cups. And best practice after you've done those movement is to briefly follow up with some massage or gua sha tool to just get any blood circulated well. Safety, right? What are number 6, what are some contraindications and precautions with using myofascial decompression, using negative pressure with cups? Well, I'm just gonna list a few in regards to contraindications. Um, we really like over infection sites we don't want. Someone with osteomyelitis, not appropriate. Anybody that has like unstable epilepsy, excuse me, or has loss or altered sensation in their skin. No open wound application. Those that have cancer or tumors, we're not putting it over those sites. High risk pregnancies, eyes and genitals are not on the table. No putting negative pressure there. Any acute or very severe cardiac disease, we want to be mindful of just because of the fluid shifts that can happen after cup application and during. So, uncontrolled hypertension would be a good example of that. Congenital heart failure, hemophilia, thrombocytopenia, these are off the table. We're not cupping these humans with these conditions or those that are on high dose anticoagulants. So we want to be smart in our application. Um, some precautions just to consider is like over surgery sites. Everybody always asks me that. That's not somewhere we want to go right after. And you should work with your surgical team um, in regards to safety to put cups around. There is some great evidence that in earlier stages you can kind of go distal to that site. And then as the scar matures, start using cupping can be very appropriate. So that's kind of a precaution. Anyone with pain hypersensitivity, because there is a discomfort associated with that lifting and negative pressure. This is not a no pain, no gain. We don't want this to be a painful treatment. So those are kind of the big things to be mindful of and your care of this human in regards to contraindications, precautions. Moving on to number 7 that I want you to know. This treatment fits into our normal test, treat, retest model. And it's really powerful for the patient. This is not quackery, right? We are testing to make sure it actually makes a change. So we will test something, range of motion, sometimes even strength, and or a movement efficiency pattern, and then we'll do the cup, right? 3 to 5 minutes of treatment, 8 to 10 maybe total for application and taking off the cups and kind of massaging the area, and then you retest. And it's again, that treatment, it takes such a short amount of time, and then to see a quick change, it's kinda like manipulation or dry needling. I see, great effects, in using this treatment and creating that modulating window of opportunity to retrain a pattern or a movement and load that human up. That's what's most important, what comes next, not actually the cup application. So appreciate this fits in our regular clinical reasoning model. And I have to admit this, and that I used to be a big doubter of using cups for therapy. When I saw Michael Phelps, I would say, I don't want to make my patient look like an octopus. I'm never doing this treatment. So I'll be the first to admit that I was a big doubter here. But I've seen it have really great effects. And I really appreciate the science that we're learning behind the effects. Okay, number 8, we're almost there, team, at the end. This is such an easy tool to learn and to put in your toolbox. It's very accessible as a healthcare practitioner in any state, right? Where there's no battle, right? Like we have with dry needling or being fancy with our language for high velocity, low amplitude thrusts, right? Using manipulation, we can do this. I definitely recommend getting trained on it, but it's just a really accessible tool. If you have this top 10 in your background, and then recommend taking a course as well. Number 9, patients seem to like it. It's pretty hilarious that the thing we're probably most concerned about, which is that the markings, right? Whether you use the circle curve cups, we now have heart and star-shaped cups. Patients freaking love these marks. I think the underlying sadomasochism in us all, they just love having these marks as a battle scar on their bodies. So I find patients are less worried about that. If they have like a wedding or an event coming up, I definitely let them know marks could occur. That's not necessarily our goal for this, but appreciate um, that is not the goal, and that patients don't actually seem to mind. They like to show it off. Allows a good opportunity to dispel some myths. Those marks are not toxin removal or bringing old things up to the skin. Just because it's darker doesn't mean bad things or bad chemicals are coming out of your body. Some ancient thoughts were that. So we haven't found a clear causation correlation there. It's very weak in the literature here. The best thing to kind of describe to the patient in regards to the marks that occur, and there are varying degrees of color and changes in the tissue, but it's basically helping with lymphatic efficiency through blood flow and movement. That's really what's being sought here. And so those marks are just the lingering effects of that. I keep it pretty simple when I'm explaining it. Number 10, and then you can go back to your Tuesdays. Patients get better. Not only do we see a change in tissue health, but right away after we test, I see patients being able to move better, less painful. So therefore, it impacts their world for the better. So when paired with that test retest model and a great follow up and giving an HEP, right, that continues to promote that great movement pattern that's restored or decrease pain associated with the movement. Those are really our keys. So it's just another tool in our toolbox and an opportunity to modulate pain and serve our patients better. I'd love to see you all in an extremity management course so you can learn how myofascial decompression fits into extremity management. Definitely take Chris DiPrato's course if you're wanting to learn more. Thanks for your time this morning, everyone. Cheers. Happy Clinical Tuesday.